Prostate cancer is generally a low-risk cancer with slow growth and relatively limited aggressiveness. Its diagnosis is often delayed because it is asymptomatic in the early stages. As the disease progresses, conditions such as weakness, anemia, bone pain, paralysis after metastasis to the spinal cord, and kidney failure due to bilateral urinary tract obstruction may occur. For this reason, it is important for men to have regular prostate cancer screenings for early diagnosis. Because the earlier the disease is diagnosed, the better the treatment and survival rate. For screening, a biochemical parameter called PSA is checked in a blood test, and a prostate examination is performed with a method called rectal digital examination. Prostate cancer is defined as malignant tumoral formations resulting from abnormal and uncontrolled proliferation of prostate gland cells, which are part of the male reproductive system. The prostate gland is a walnut-sized organ located in the lower abdomen just below the bladder and encircling the urethra. The urethra. Prostate is a Latin word meaning protruding secretion of the hormone testosterone, which plays a regulatory role in the functions of the reproductive system in the male body, and semen production, which protects the vitality and mobility of sperm cells, are among the important functions performed by the prostate gland. Among the people, benign prostate enlargement, which occurs with advancing age, is known as prostate, the name of the organ. Worldwide, 60% of prostate cancer cases, a disease that affects thousands of men in middle age and older, are detected in people over the age of 65. Symptoms of prostate cancer usually start to appear in the later stages of the disease and can manifest themselves with many symptoms. Since the disease progresses insidiously, it can only be detected at an early stage in asymptomatic people with regular screening. Symptoms are not characteristic and can also be seen in other prostate diseases. There are many common symptoms of prostate cancer: difficulty urinating, frequent urination, blood in urine or semen, erection problems, pain during ejaculation, involuntary weight loss. Prostate cancer can cause severe pain in the lower back, hip or leg, as it often metastasizes can spread to the bone. Since the prostate gland is located just below the bladder, the most common symptoms are problems with the urinary system. After enlargement of the prostate gland due to a tumor, the prostate gland may press on the bladder and urinary tract, causing symptoms such as frequent urination, intermittent and slow flow urination, and hematuria, which is blood in the urine. The exact cause of prostate cancer is unknown. However, as a result of various studies, some risk factors for this type of cancer have been identified. In its most general form, prostate cancer develops as a result of abnormal changes in the DNA of a normal prostate cell. DNA is the chemical structures that make up the genes in our cells. Our genes control how our cells work, and so changes in DNA can affect how cells work and divide. Certain genes that help cells grow, divide, and survive are called oncogenes. Genes that normally control cell growth, repair mistakes in DNA, or make sure cells die at the right time are called tumor suppressor genes. Mutations in some oncogenes and tumor suppressor genes are risk factors for prostate cancer. Other risk factors for prostate cancer include advanced age, black race, family history of prostate or breast cancer, high male hormone levels, high consumption of foods rich in animal protein and fat, obesity, and sedentary life. Prostate cancer may require screening at an earlier age in the presence of certain conditions that may indicate a genetic predisposition. Individuals with a first-degree relative with prostate cancer have a two-fold increased risk of developing this disease, especially in the case of a history of prostate cancer in siblings. The increase in risk is more pronounced. There is an increased risk between diet and prostate cancer, especially in people with a Western diet. Excessive consumption of milk and dairy products, a diet rich in saturated fatty foods, high calcium intake, low vitamin D levels, excessive consumption of red meat, and processed meat products are among the dietary characteristics considered to be effective in the development of prostate cancer. Advanced age is another risk factor for prostate cancer. Care should be taken as this disease occurs more frequently after the age of 50. Obese individuals may be predisposed to prostate cancer. In these people, the disease may also follow more aggressive course, and a healthy body weight is considered among the important conditions for prostate cancer, as recurrences can be seen after treatment. Prostate cancer treatment options depend on the rate at which the cancer is growing, its spread, and the patient's general health. They also depend on other factors, such as the potential benefits and side effects of treatment. Treatment options include surgery, chemotherapy, radiotherapy, hormonal therapy, or a combination of these. If the disease is diagnosed at an early stage, a period of follow-up without any treatment may be recommended. The most common and effective treatment option is surgery and usually involves the complete removal of the prostate. Prostatectomy. Prostatectomy refers to the removal of prostate tissue affected by cancer. Radical prostatectomy is the surgical removal of the entire gland. This surgical procedure can be performed as open or closed surgery. In open surgical interventions, the operator aims to reach the prostate gland by making a large incision in the lower abdomen. The perineum area between the rectum and the scrotum testicle is another area that can be preferred in open surgical procedures for the treatment of prostate cancer. Closed prostate surgery is performed laparoscopically. In this procedure, cameras and surgical instruments are inserted into the body through small incisions to remove the prostate gland piece by piece. Laparoscopic procedures are less invasive than open surgical procedures. The degree of invasiveness and the incisions are smaller. In both open and laparoscopic surgery, the surgeon will examine the lymph nodes and other tissues surrounding the prostate for signs of disease. Prostate cancer is a disease that does not cause obvious symptoms in the early stages. With the enlargement of the prostate gland, symptoms such as increased frequency of urination, nighttime urination, difficulty in starting and maintaining urination, blood in the urine, and painful urination may occur. In addition to symptoms related to urination, sexual function and performance may be negatively affected over time. In prostate cancer patients, pain felt especially in bones such as the spine, hip, and ribs may indicate that the disease has started to spread outside the gland. In people who apply to health institutions with these symptoms, the physician primarily evaluates the patient's medical history and physical examination for the diagnosis of prostate cancer. Among the physical examination procedures, digital rectal examination performed from the anus for the diagnosis of prostate cancer is at the forefront. Digital rectal examination can detect abnormalities, asymmetries, and suspicious nodular structures in the prostate gland. Prostate cancer is detected in approximately 1 in 5 patients whose digital rectal examination reveals abnormalities. During this examination, the physician puts on an examination glove and examines the surface of the prostate with his index finger. Prostate-specific antigen PSA is an important biochemical parameter of diagnostic importance for prostate cancer. The level of this substance in a person's bloodstream is found to be elevated in approximately 80% of prostate cancer patients. As with other types of cancer, the staging of prostate cancer examines the size and extent of the tumor, whether the lymph nodes are involved, and whether the cancer has metastasized to other parts of the body. Stages for prostate cancer are expressed as numbers between 1 to 4. The most advanced stage of cancer is stage 4 prostate cancer. Stage 1 prostate cancer refers to the period when the disease is still in one half of the prostate and no spread to surrounding tissues has been detected. In this period, the PSA values of the errors are usually detected below 10. Stage 2 prostate cancer is divided into two substages, A and B. In stage 2A, the cancer is still confined to one half of the prostate, but the PSA value of the person varies between 10 and 20. If the tumor is detected in both halves of the prostate, we can talk about stage 2B prostate cancer. The disease may progress over time and become stage 3 and stage 4 prostate cancer. At these stages, the capsule of the prostate and surrounding tissues are involved. In stage 4 prostate cancer patients, the bones are also involved. Consuming foods that are good for the prostate can reduce the risk of prostate cancer. Especially foods containing vitamin E, zinc and selenium are good for the prostate. Apart from nutrition, factors such as regular physical activity and having a healthy body weight can also be beneficial in preventing. Among the foods beneficial for prostate health: garlic, eggs, and seafood containing selenium. Zinc-rich nuts, milk and legumes. Fruits and vegetables containing lycopene, such as tomatoes, watermelon, and rose hips. Whole grains, fruits, and vegetables. Selenium and zinc are among the minerals considered important for prostate health. Regular intake of selenium has been associated with a reduced risk of prostate cancer, especially in tobacco users. Zinc is considered important because of its effects on DNA repair and thus on the cell cycle. You can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.